upstairs when there are no elevators, I look at the people in the room and I'm like, do you feel strong today? And most of the time they'll be like, yes, I feel strong, because people don't really want to admit that they don't feel strong. And I'm like, perfect. Do you want to carry me up the stairs today? And they're like, they panic a little bit. And they're like, oh my gosh, can I lift a wheelchair? I don't know. And then we figure it out. So I'm very, like, I sometimes have to be brave and trust people to lift my chair and carry me and be, like, believe that I'm not going to fall on my face. But it's risky, and that's fine. But I think it's really about people being willing to help in that way. And there's always a way. I think that's the thing to take away, that there is always a way for you to be supportive and to help out. And if you think that somebody needs help, you can offer to help. You don't, and if they say no thank you, perfectly okay. And you still did a good job even though they didn't want you to help them. Does that make sense?
Yeah.
Beautiful. Good question. Do we have other questions? What? Thoughts?
I do have a question.
Yeah.
Like, I've been meeting a lot of disabled people
Yeah.
sometimes,
Mm-hmm.
but like they're extremely aggressive. Like when you want to ask a question to them and know how they feel about not having the same possibility as a normal human being, like they just feel insulted by your question. So I wanted to ask you, like, do you feel excluded from human beings? Like, how is your day-to-day life? How do you take a shower and all the stuff?
Yeah. So, I am a very disabled person, right? Super disabled over here. Hi. I need a lot of help with a lot of things. So I can't get myself out of bed in the morning. I can't, like, dress myself. I can't shower by myself. I have help for those things, right? But once I'm, like, in my chair and, like, I have my phone, I'm pretty decently able to do stuff. You should leave me by myself with my computer for, like, 6 hours. As long as I have, like, a cup of coffee. Because that, like, I need to be awake, right? So I think that we work plans and we make systems so that my life can be easier. And I always have people around me to support me to do the things that I want to do. But it doesn't mean that I can't do things just because I need help to do them. Yeah? Cool. Seeing some nods. So that's good. Do we have questions from the online people? I don't know how to engage with the online people. Okay, cool. Like, we see you. Hi. Other questions? If you have somebody in your life who's disabled, right, we had a few, what do you do for those people? Do you support them differently? No? I love that. They're just like a part of everything and like you figure it out. Yeah? Cool. I think I want to check my phone because I made question notes here and it takes a second, but it's okay. I think Okay. Okay. What does inclusion mean to you? Do we know what inclusion means? No? What it like the word itself or like the idea? Okay. So inclusion to me is that every person has space to do what they want to do, and everybody is able to go into all of the places that they want to go. Yeah? And I think that's pretty simple. Like, it doesn't have to be this big conversation about how we get all the disabled people in the world into the room, right? But there is a need for people to be aware that when there are like two of us in a space, that we need to be accommodated and supported to be in that space. Yeah? Is this making sense?
Yep.
Beautiful. I'm excited. Okay.
Would you like to see the video about
We have it?
Amy's,
Yeah.
path to inclusion? So how she got in here and how she won the International Children's Peace Prize?
The video has arrived. Yeah? Okay. We come to watch?
Perfect.
My name is Katie Mycroft. I'm 21 years old and I am an ability activist. My main drive is for different disabled people to be included and accepted the way we are, because we cannot change our disability, but we can change the way people see our disability. I believe that we can do it. We can make disability just another trait instead of a reason for exclusion. To create such an equal society where we work together for a common goal, each in a different way, will not be easy to achieve. But we have to start somewhere, and we have to dream big. When we landed at Emmazaal Airport, I think there was just such relief that we made it. I'm so excited! The support crew was there to help us through when it got tough. And they were just as committed to it as we were, and that was amazing. On the 3rd of September 2015, I became the first female quadriplegic to summit Mount Kilimanjaro.
so much. Thank you.
I'm incredibly proud of her courage, her resilience, her sense of adventure, and the way in which she claims her life.
When I got out of the summit, I can't believe, because she got such a strong heart. She cannot give up. She's ready to do it, she wants to do it, and she did it. And I was saying to her, I pray my kids to be like you, because you are so strong.
Many people see Kaylee as being extraordinary because she lives an ordinary life. At the Kaylee campaign, we truly focus on our young recipients being everyday heroes. That means we encourage them to claim their power, see their ability, live in possibility, and act as agents of change within their families and within their communities.
There's a song by Nickelback. It says, what's worth the price is always worth the fight. And I believe that the price of inclusion is definitely worth the fight. Thank you.
So let us stand together, united by a dream. Let it live forever, to give wings to all the angels.
That was insane that we did that. I think for me, I'm gonna close with like two things. Yeah. I think what we need for the world to be more inclusive is to remember that we need other people to support us to do cool things. Right. And I think the other thing is that we need to not listen to the people that think that we can't do things. Because if I'm gonna assume that everybody here has had a moment in your life where you wanted to do something and you told somebody nearby and you were super excited about it, and then they kind of looked at you and they were like, that's a bit lame. And you like lost the excitement of it. And I think we all just need to learn how to not listen to those people. Find the people who are excited about what you're doing as well, and make sure that you take those people with you when you go and do cool things. Because a lot more stuff is possible and accessible when you surround yourself with people that think it's a good idea to do it. Does that make sense? Yeah? Okay, cool. So I hope that made this workshop, even though it was a little bit all over the place, I hope that you can consider how people move around in places a little bit more and think about how you can be helpful to the people around you to make them feel welcome and included and accepted wherever you are. And that's a really powerful thing that you can do for somebody. Yeah? Okay, cool. So I think that's me. And yeah. And I hope that you have fun in your other workshops and that you learn stuff and that you take away stuff and that today is good for you. So thank you for listening and paying attention.
I think you guys can go on to your next workshop. Yeah, I think it's very for helpful organization. So I was so sorry also that like we had to keep walking in and out.
No worries.
Yeah.
The next one will be better.
Next one will be great. When
Hi.
Hi, how are you, Kylie?
Good, how are you?
Good, fellow South African here.
Yeah, hi.
How are you? I'm Rafida and this is Buntle.
Hi. South African.
Test. Test, 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 testing, 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 testing. Test, 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 test. Oh ja, niet? Blijf doorgaan.
I may let you go.
Are you staying in here?
I am staying here.
Because I don't think this is mine.
Okay.
Niks weiter. Je beweegt.
Ja, dankjewel.
Hallo, ik ben Jan.
Sorry, hello.
Hi.
Starting shortly. We're finishing with the PowerPoint.
Oh,
setup.
perfect.
Just to be clear, this is healthcare. This is not the presentation on accessibility for children with disabilities. This is the presentation on healthcare.
I will not be offended if you don't care about health in this room.
Okay.
If you want to listen to accessibility, I think it's the third round again.
Yes. Is this clear for everyone? Perfect.
Okay, cool.
And I will set up the
Okay.
PowerPoint in a second.
And he'll turn on my mic thing. Hello. I lost my voice this morning. Can you hear me? Oh, this works. Okay. I'm going to have to whisper because I lost my voice this morning. I don't normally sound like this. And I did not smoke a pack of cigarettes. That would be very bad. Do not smoke. So I'm going to drink tea the whole time. And we're going to power through this. I'm Neha. Can I just really quickly, while we're setting up this PowerPoint, just tell me all of your names and how old you are?
Daniel, 22.
Okay.
Owen.
Cool.
David.
Dino.
Cool. You go first. Yeah. Cool. Okay. Okay. Oh, I thought you said yours. Go ahead, please. Okay. What are your names? Okay. Okay. What are your names back there, too? Did you say them already? Okay. Okay, and you guys can hear me okay if I talk like this? This is horrible. I've never had my voice be like this. Oh my gosh, okay. If I die halfway through, just let me just go on, I guess. Don't come save me. Okay.
So let me introduce you quickly.
Please.
My name is Martina. I work with Kids' Rights. Welcome to the first ever International Youth Summit. Thank you so much for being here. Today and right now, you have the privilege to have this amazing presentation by Neha Gupta, who won the International Children's Peace Prize in 2014 for her work with orphan care. She is now a doctor. She will tell you all about it. And she's going to talk about health advocacy. So if you can give her a very warm welcome, we're very happy to have her.
Okay. I'm just going to cough this whole time, just to warn you. Well, thank you so much, everybody, for being here today. My goodness. This is going to go so well, guys. For this presentation, for the whole summit. I'm excited to talk to you about something that's incredibly important, which is healthcare. How each of you, for those of you who are joining, I lost my voice because I talked way too much yesterday at the Peace Prize ceremony. But how each of you can be champions in your communities for healthcare. So let me tell you a little bit about myself. That's me. I'm an emergency medicine doctor in Washington, D.C. I take care of patients of all ages, of all genders, of all backgrounds, at basically all hours of the day. Nighttime, daytime, doesn't matter, I am there at the hospital. I take care of patients that are suffering from heart attacks, from reproductive emergencies, from mental health emergencies, from violence and trauma, including gunshots. My desire to be a doctor was driven by my own head injury that happened about 10 years ago, and I knew that I wanted to advocate for patients in the way that I would have wanted for myself. My journey to advocacy began when I was very young. When I was 9, I founded a nonprofit called Empower Orphans, which aims to provide underprivileged kids around the world with access to education, access to healthcare, and we've been able to help 25,000 children in India, in Haiti, the US, Uganda. We've done more than 150 projects ranging from, again, healthcare, education, mentorship. And then in 2019, I co-founded State of Youth and was on the youth board for 2 years. And if you haven't heard about State of Youth today, you will hear plenty about it. But it's all about empowering young people like you guys to take action for our world's most pressing issues. And you're hearing about all of those issues today. And one of those is healthcare. Over the last, now it's been, since 2019, so 5 years, we're in 219 chapters, around 40-ish countries. All right, so next slide, please. All right, so this is what we're going to be discussing today. What health advocacy is, some of the major issues in global health, social determinants of health, action steps, and we're going to do an activity of how you guys can really get involved in this. All right, so let's start off with, what is health advocacy? Can I just have like a few people tell me their thoughts about, you can just shout out a phrase, a word, whatever you think health advocacy is to you. What? What did you say? Where is it? Oh.
I don't know
Okay, that's okay. Perfect, that's why you guys are here. Does anybody know it that wants to explain it?
I believe it's about awareness regarding health and to pay attention to it.
Yeah, perfect. It's all about, and I think that health advocacy, which you'll learn about, involves a lot of different things. But it's about helping people access healthcare, educating people so that they can make better informed decisions about their healthcare, decreasing barriers to care, and building coalitions for healthier communities locally and globally. All right, so we're gonna start with some questions right now. Does everybody have like their phone that they can use for Mentimeter? I guess this is the thing you guys use here, Mentimeter. Okay, all right, so you're gonna type in that code at the top. My voice is slowly coming back somewhat. Okay, so yeah, so you use this code up here, or you can use this QR code. Let me get out of my head out of the way. What? It's good, okay. Is everybody in? Everybody in? Still having trouble or no? No, everybody's in? Okay. All right, so I want everybody to type in what they think the health issues that they see. Is it working for you guys? It's working? Okay, great. Okay, what health issues you see in your community? So we're gonna type in a word, a couple words. We're gonna make a word cloud of it, okay? All right, I'll give you like 30 seconds to do that. Yeah, that's a good one. Yep. Yeah, you can talk to your neighbors, talk to people, brainstorm. Oh, I love this. Perfect. Okay, so far we have depression, eating problems, asthma, lack of access, cancer, poverty, anxiety, heart problems, allergy, suicide. Mental health. These are great. Smoking. Smoking is a huge issue. Diabetes. This is awesome. Okay. Let's go. Oh, we got some more ones? Self-harm. Good. Okay. All right, let's go to our next question now. Do you think that healthcare is accessible to children in your community? Just yes or no. Yeah. Good question. Good question. So it means how easy is it for children in your communities to go to a doctor if they're sick, to get a checkup, to get emergency care? Like let's say if they have a broken bone or they have asthma, how easy is it for them to go to the doctor? Good, okay. I don't know how many we have in this room, but I'm like assuming it's probably close to there. Okay, now pretend that this is not the question anymore, or that you didn't do this. How accessible do you think it is globally in other countries? Show of hands. We'll go with yes first. All right, we'll go with no. Yeah, I would agree. I would agree. And I think that the Netherlands is really unique, right? It's very different than the United States, where we do not have universal health care. We have a lot of people without health care in the United States who are most of my patients. Most of my patients are people without access to care at all. They are homeless. They are addicted to drugs. And it's a really unfortunate situation, but that is a lot of the patients that I see in the United States. All right, next question. All right, which of these issues do you think most impacts children's access to health care globally? There's no right or wrong answer here. Okay, good. You're listening to what I'm saying. You said insurance cover, I love that. Okay, education, health literacy, social integration. Oh, okay, you didn't have to do that just because I said it out. Gender and ethnic, okay, discrimination, location barriers, and other. Anybody in other, do they want to share what they were thinking? Who put other? Who put other? Anybody? Anybody? Any takers?
I think maybe
Yeah.
like being ashamed to seek help for a problem.
Yes, especially for mental health issues. Absolutely. There is no shame in that, but it is stigmatized. Absolutely. So there are countless health conditions and issues that affect our communities, right? You saw some of them on the screen already that you did in a word cloud. Cancer, infectious disease, mental health, substance abuse, health emergencies, violence and trauma, reproductive health issues. I don't know if any of you listened to Matt and Ryan's speech about gun violence. Can we go back to the presentation? And then to the next slide. Sorry. Okay, perfect. And then the next one. Okay. Roughly 1 billion children across the world lack basic necessities to, nutrition, decent housing, sanitation, clean water. And then we can go to the next slide, please. Where we live, the education that we receive, family's income, relationships, we all have impact our well-being. Those in wealthier countries with less inequalities have better health outcomes, right? It's kind of a given. These are known as social determinants of health. Has anybody ever heard of those before? Yeah? Was that a yeah? Yeah, okay. So let's talk about money. These are like the biggest 5 things. Money, when people can afford healthy food, healthcare, safe housing, it dramatically impacts their health, especially for people with chronic conditions, disabilities, injuries. In terms of social and community, positive, am I doing this by accident? No. If they have positive relationships, right? Like you guys all have your friends at school. The more interconnected you are at school, the happier you're gonna be in terms of your mental health. The more physically active you're gonna be if your mental health is better. And that is extremely important for kids in different communities around the world, that they have support, whether it's from their parents, their families, their communities. They need to have a group that they are part of, and that impacts their well-being. In terms of the neighborhood and different environments, if you've ever heard of, unsafe, I don't know not as much about the Netherlands, but I'm assuming that there are unsafe areas in the Netherlands too, right? Areas that might be more prone to violence, to gun violence and traumas. That kind of comes with being in a safe neighborhood or not being in a safe neighborhood. Lack of access to healthy grocery stores on your block can lead to poor nutrition. Then you have the healthcare access. How physically close is your nearest facility, right? Your doctor's office, your urgent care, how close is the nearest grocery store? All of these things are really important for your preventative health. And then your education. Children who might come from lower income families are more likely to struggle, maybe not graduate, less likely to have jobs, less likely to have lower health or higher health literacy. In the United States, the average that Americans read at is a 5th to 6th grade reading level. So think about how much that impacts your health and how much you know about your own health and can read your own paperwork then, right? By thinking about these social determinants of health, by understanding them, we can take action and we can work together to create more supportive communities that are healthier, right? With less inequalities, that are stronger. All right, next slide, please. Okay, so here are some ways that you can be involved in advocacy. The first one is interpersonal. An example would be educating your peers about equal access to menstrual products. Community would be organizing health awareness campaigns to talk about nutrition at a local community center, providing healthy food. Events to connect therapists with victims of gun violence. An example of being plugged into a health system and advocating would be, you could be there as a nurse, a doctor, a volunteer. You could help as an individual level. You could help at the systems level too. Or you could just go in and volunteer and donate toys. At the policy level, you could contact your local officials for access to mental health for teens. You could publish research on healthcare disparities in specific populations. So there's so many ways. Did any of you know that those are like all the options that you could do? Okay, cool. Okay, next slide, please. Okay, so we're gonna do an activity. I'm gonna explain it. The most important thing in understanding this is kind of my general outline for understanding how to go about with health advocacy and how to start, right? So the most important thing is first, your needs assessment. Who do you want to help and what are their unique needs? Because every single community has a different set of needs that is very unique to them. One size does not fit all, and you really have to understand and ask the questions. You pick your issue, and then you research, you become an expert in that topic. You figure out, why does this issue matter so much? And you craft a compelling message. What do you want people to know about this? What do you want them to know so that they can be ignited to take change too? Then who you can ask for help. Is it your friends, your family, your church, your school, your soccer team? And then using your voice, how are you gonna spread your word? Is it flyers, is it social media? And what action do you wanna see, right? We talked about all the different ways. Is it a policy change? Is it a physical difference in an interaction that you wanna have? Is it physical kind that you want to see a difference in, like donation of hygiene products? So what we're gonna do is everybody turn to your neighbor. You're gonna split up into two. You're gonna mostly focus on just 1, 3, and 6. So it's pick your issue, what message do you want people to know, and what you want your impact to be. And then we're gonna share, okay? Take maybe 3 to 5 minutes. You don't need to be an expert in this topic. I just want you to think about one thing that you've seen recently that's important to you and that you feel like you want to stand up for. I'm not saying you have to start a whole nonprofit out of this, but I want you to kind of start thinking about kind of how that process looks like, because every action does start very small. Okay? Cool. I think we're pretty even here. And you can be groups of 3 too. Okay. Okay, good. Okay, perfect. Was that? Oh yeah, can we go back to having them up there? So they can see them. It's helping. Thank God for you. And if you have any questions, please ask. For later. Huh? Do something. Do you have a partner to work with? You have a partner to work with? You want to join them? Yeah, join them. Does anybody not have a partner? Hi. Perfect. Okay, perfect. That's perfect. There's plenty of time. Okay. Oh, and to clarify, if you want to do 2, 4, and 5, you can, but it was just, if you had time, fine. Oh, sorry. Did I ruin it? Okay. All right, 1 minute left, so we have time to share. Okay. All right, it's getting quieter, so I'm assuming everybody's done. Yeah? Okay. What group wants to start us off first? Everybody done? Yeah? I can't talk louder than this, I'm sorry. Okay. All right. Which group is starting us off? Who wants to start? Otherwise, I'm just going to volunteer a random group to go first. Yeah? Okay. Okay. You want to? Okay. I saw in the back your hand up first. You want to go first? Yeah, you want to come up here, please? Come on up. Yeah, please. Good, yay. All right, let's hear it. Does that work? Another mic? No.
Hello, yes.
Oh, yeah, perfect. Wow.
Okay, so we were about vaping.
Oh, vaping, yeah.
Yes.
Perfect, that's a great issue to pick. All right, so yeah, your issue, and then what do you want people to know about why it's important?
It's not good to do because it can affect your health. Yes.
Yeah. Yeah, that's true.
Yeah.
And if you were to take action on this issue, what kind of impact would you want to see differently?
That people don't sell them anymore.
Okay.
Because
That would be
they're
all.
sold everywhere.
Yeah,
Yes.
I love that. That's fantastic. It's so true. Good job. Good job. Yeah. Do you want to pick the next group? It's not that scary, I promise. It is? Yeah? You can sit in your seat and do it? All right, who's next? Let's... Otherwise, we can... All right. Okay. All right, let's hear it.
Our issue is over smoking.
Okay.
It's
Good.
very bad for you and others around you.
Yeah.
Because it's make your lungs black.
Yes.
And and yeah. And we think it's better that they don't sold it in the shop, because yeah, it's very bad, like vaping.
Yep.
So
Yeah. So your impact is you want to see it never sold again.
yes.
I love it. Amazing. That's awesome. Good work.
We got like suicide.
Almost done. Okay, we're almost done.
We got like suicide.
Yeah.
It's very bad for yourself because you're gone, but the other people is very it's an impact on your mom and dad, like the people around you, and yeah, it's very bad. Yeah.
Yeah.
And also make it easier to for people to talk to other people, like your parents. And also sometimes when you want to talk to like a psychologist, you have to wait for a couple months, and I think we have to make that shorter, so that's not an obstacle, so you can talk easily to other people when you're struggling.
I love that. I love that. So it's all about sorry, connecting people so that they can openly talk about their mental health.
Yes.
That's amazing. Good job. That's perfect. Yay. Okay. Anybody else want to go? Any other groups want to go before we have to go upstairs? I want to make everybody share, but I also want to be mindful of you guys getting the full experience upstairs as well with the rest of the time. So if anybody wants to go, we'll do that. Oh my. Oh my. Please don't fall. Okay.
Our issue is drugs because your head don't do your head.
Like you're not in the right headspace when you do drugs.
What your head says, don't do your body.
Yes, agreed.
So
Agreed.
you're not under your own influence.
No, wait.
What's influence?
No, you're right. And I see that in my patients. If you were to take any type of action to help your community have less people doing drugs, what kind of action would you want to take? That is true. That's a good one.
They have to make harder rules, so they don't have easy drugs and just do it.
Yeah.
Stop it.
Well, are you going to be like a new policymaker here in the Netherlands?
Yes.
Okay. All right. Well, you heard it here first. Yep. Yep. Perfect. Okay. I hope you guys enjoyed that. I know it was a very short session. I just have one more thing to say really quick before you guys go. I just want you guys to kind of start thinking about how many things affect your well-being and the well-being of people around you, the well-being of other people around the world. You can be the catalyst for change in your communities. The last thing I want you all to do is just scan if you want to become part of State of Youth and start thinking about issues that affect other people around the world and start really kind of getting into topics like this. We'd love to have you join. and be a leader within our space. So feel free to scan the QR code and then we can head upstairs. Okay. Okay, outside. Who knows where we're going? Thank you guys. Thank you everyone. Thank you. Of course. Should we take one picture?
Children to like take you seriously. That's so impressive.
I am very good at being bossy.
Yeah, no, you're so good at it. But like, you know, like, you also do it in such a nice way that they actually want to do it. Yeah, yeah. Like those two boys.
I know.
And there was something like drugs. And
I know.
Okay.
Don't do drugs. Don't sell drugs.
Don't sell drugs. And in my head, drugs are already illegal.
I know.
Like, what do you want to do?
I literally
don't sell anything.
It's like I know. Don't sell anything at all. It's like my favorite thing watching them like just be rowdy and then just being like taken seriously, and I'm like, I did my job. That's all I cared about.
Truly.
Literally all I cared about.
Because they would come here and then they would be like suicide, and
I
you're
know.
like, oh my god.
I know, and I'm like, wow,
You came up
that
with
was
that.
really nice. Thank you.
It would really hurt your mom.
I know. Someone goes, and your dog. I was like, true. This is true.
Yeah, the dog would be sad.
It would be sad. But yeah, that was. I mean, thank you for helping me.
No,
Oh my gosh.
I did nothing.
Thank you guys for helping with the PowerPoint.
I mean, yeah.
It was definitely
No, and especially
try my best.
considering your voice.
Yeah.
Is there
Next
more